Chapter 8, Part 2, Pregnancy and Childbirth. In this second portion of Chapter 8, we're going to be discussing what occurs during the development of offspring, what types of changes occur within the mother during a pregnancy, and then we're going to discuss childbirth. So let's pick up where we left off last time. In our last lecture, we had talked about the process of fertilization. So after an embryo is formed through fertilization, that zygote, that initial form of an embryo, is going to begin the process of cell division. Now these are multiple mitotic divisions that are referred to as cleavage. And this type of mitosis, called cleavage, is a type of division where that embryo isn't going to change much in size. However, it is going to change in the number of cells. And that's important because as the cell number increases and the embryo size stays roughly the same, that's going to increase the surface area to volume ratio. That's going to enable the embryo to be more efficient in the uptake of nutrients and more efficient in getting rid of any waste. So here we have what would represent a single-celled embryo. It's going to divide from 1 cell to 2, and then to 4 cells, and then to 8 cells. And then during this process, notice the embryo doesn't change much in shape. So keep in mind, during this process of cell division, as this goes from a single-celled embryo to 2 cells, to 4 cells, to 8 cells, to 16 cells, initially this is called a zygote. And then after about 72 hours, when it reaches the 16-cell stage, this is called a morula. Keep in mind, this process of cell division is occurring in the fallopian tubes. As this embryo is dividing, it's making its way into the innermost lining of the uterus called the endometrium. So this process of development, while that embryo is making its way toward the endometrium, is going to take about 5 or 6 days. And after about 5 or 6 days, when the embryo is a couple of hundred cells, that's going to break out of the zona pellucida and it's going to become embedded in the endometrium. At this point, the embryo is referred to as a blastocyst. A blastocyst is a ball of cells that continue to divide using nutrients provided to the egg until implantation of the endometrium. So this hollow ball of cells is not yet differentiated. So if we were to take a look at this blastocyst, we would see that initially this blastocyst has some extensions. And these extensions are referred to as chorionic villi. Now these chorionic villi are important, and they're indicated as these purple extensions here. And what these do is they help increase the surface area of this blastocyst. These are actually going to embed and they're going to intertwine with some of the blood vessels of the endometrium in the mother. So later this is going to become part of the placenta, but this is going to aid in nutrient uptake and waste removal. There's also the trophoblast cells. Now these cells are the cells of the periphery of the blastocyst. And these trophoblast cells, these are important because these are also going to be part of the placenta. The most important cells, however, are a cluster of about 20 to 30 cells within this embryo. This hollow ball of cells has these right here referred to as the inner cell mass. Now this inner cell mass of about 20 to 30 cells are not yet differentiated. They have the potential to become virtually anything in the body. And it is these inner cell mass cells, sometimes called ICM cells, that are going to be especially valuable. These are sometimes referred to as embryonic stem cells because they've yet to differentiate. Now in humans, pregnancy is considered to be established at implantation. And during this process, the blastocyst has already begun to secrete HCG. This hormone continues to double every day. During the first trimester, as it doubles and as it increases, sometimes morning sickness can persist and it can be especially difficult. So typically women experience morning sickness during the first trimester of pregnancy, and morning sickness usually dissipates after the first trimester. Now, the physiological significance of morning sickness is because this embryo is very frail, very fragile at this time, depressing the mother's immune system is going to give the embryo a greater chance of development and survival without being attacked by the mother's immune system. Unfortunately, the consequences are women feeling very sick, nauseous, sometimes in the morning, sometimes in the evening, and for some women throughout the entire day. It's actually not uncommon for many women to lose weight initially during a pregnancy due to the morning sickness. So when a woman does identify that she's pregnant, some symptoms of a pregnancy include missing a period. It's important that a woman does miss a period because during a woman's menstrual cycle, she would lose the inner lining of the uterus called the endometrium. And if a woman did have a period, then she would lose that fertilized egg. So perhaps one of the most common symptoms of a pregnancy is missing a period. Morning sickness, fatigue, breast tenderness, weight gain, and frequent urination. So now that we've gone through the process of fertilization, we've talked about the development of the embryo, we've talked about implantation of the embryo. Now let's talk about, as the embryo develops, why the placenta is important and what the placenta is. Well, the placenta is an ephemeral organ connected to the umbilical cord. And this ultimately is a temporary organ that's going to aid in the filtration of nutrients and waste. This is where oxygen, nutrients, carbon dioxide, waste, and hormones will be exchanged from the mother to the offspring, or from the offspring to the mother. This is a great filtration organ, and it's going to prevent most bacteria and viruses from entering the fetal red blood. There are some exceptions, however. For instance, HIV is a very small virus. This virus can pass from the mother's circulatory system to the offspring through the placenta. Other pathogens like syphilis can also pass from the mother to the offspring during an established pregnancy. Although this is a great organ for filtration, it doesn't filter everything. In addition to some pathogens that can pass through, exogenous chemicals, medications, drugs, alcohol, tobacco, caffeine, amphetamines, heroin, cocaine, all of these agents can cross into the blood. Now, although we're not going to go into each and every one of these in great detail, this is indicative of the types of chemicals that could be introduced from the mother to the offspring. So during a pregnancy, especially early on during a pregnancy, a woman should be very careful on what she enables to go into her body. Alcohol could result in fetal alcohol syndrome. Tobacco, spontaneous abortion, low birth weight. Accutane, it's taken for acne treatment. This can cause heart, brain malformations. Babies born could be intellectually disabled. Thalidomide. This is a chemotherapeutic agent for myeloma, for a cancer. This can cause limb defects, deafness, blindness. Hormones that are introduced, androgens and estrogens. This could affect the genitalia and the reproductive tract of the developing offspring. Street drugs, obviously heroin, methamphetamine, cocaine. These can have adverse effects like spontaneous abortion, low birth weight, addiction to the newborn where they experience withdrawals after being born, marijuana that could affect cognitive ability, possible neuronal development of the brain, and even infections. Rubella can cause damage to the ears, the eyes, the heart. Herpes could cause damage to the eyes if exposed to the eyes during childbirth. This could also result in premature birth. HIV, well, that could result in AIDS and the infant being immunocompromised. Chlamydia, this can cause a neonatal eye infection, and if not treated, this could even cause blindness. Zika virus, brain malformations. Physical agents can also cause harm. Women that are pregnant, they shouldn't go out sunbathing. They should really minimize any exposure to X-rays, nuclear radiation, cosmic radiation from flying in airplanes. Pregnant women should even be careful when going into very hot baths or hot tubs or saunas, because that temperature could also affect development of the offspring. And typically when a woman finds out that she's pregnant, if she goes into her healthcare provider, she's often given a packet or a list of activities that are permissible, the types of foods that are permissible to consume, and just a list of do's and don'ts on what she can do or eat during a pregnancy. So here we have an example of fetal alcohol syndrome. And this girl with fetal alcohol syndrome, well, some of the symptoms for women that consume alcohol during pregnancy could include facial features with short eye slits, a flat midface, a short nose, an indistinct groove in between the lips, a very small chin. So this is the organ, the placenta, that's going to help filter some of the blood from the mother to the offspring. And again, although it's not perfect in its filtration, it certainly does aid in delivering oxygen and carbon dioxide, getting the oxygen to the baby, the carbon dioxide away from the offspring. So here you have the placenta right here, this crescent-shaped structure, and it's attached to this big muscle layer called the myometrium. Now, the placenta is ultimately going to be that ephemeral organ that's a network of blood vessels between the baby and the endometrium of the mother. So here you see the umbilical cord with blood vessels of the offspring that are going to make its way through the umbilical cord. And then here we have the maternal blood vessels. So these are the blood vessels that would be from mom on the top. They extend from the myometrium into the endometrium. However, they are not continuous with the blood vessels of the offspring. This is why the offspring and the mother can have separate blood types. Because the blood, it filters and goes right next to, but doesn't directly enter into the blood vessels of the offspring. It's just the nutrients that are going to escape the mom's blood and go to the bloodstream of the offspring. And that is why the mother, again, and the baby can have a different blood type. So nutrients are delivered, and then waste, those nutrients can be delivered to the offspring through the umbilical cord, and then the offspring can utilize the oxygen, any nutrients, and then carbon dioxide that's given off, this can be released, and this could enter into the maternal bloodstream. So really the mom, she has to eat for 2, and she also has to take in oxygen for 2, and she has to get rid of carbon dioxide for 2, and get rid of wastes for 2. So during this process of development, this is called gestation. And gestation, or the carrying of offspring that's developing, occurs within a fluid-filled medium, a fluid-filled sac. And that is very important during development, because this fluid-filled sac is good for cushioning. It helps resist changes in temperature because it's made primarily of water. And it's optimal for gastrulation. So when this embryo begins to take shape, take form, differentiate, well, some of the digits and the limbs don't stick together. So to go through the proper terminology to describe the development of offspring, an embryo is a developmental stage that starts with conception, after fertilization of the egg, up until week 8. And then a fetus is week 9 until birth. And then an infant is after birth. So during week 1, here we have fertilization. That embryo continues to divide and forms a blastocyst, and that blastocyst implants. What's interesting is that week 2, gastrulation occurs. Now, gastrulation perhaps is the most important thing that's ever happened to anybody. Gastrulation is the development of a body plan from an embryo into 3 distinguishable germ layers. In other words, gastrulation is what takes this undifferentiated ball of cells, and it's what's going to enable this ball of cells to form tissues, organs, and organ systems. This already begins about week 2 after fertilization. That ball of cells needs to develop into a complex individual. So this process begins pretty early. So those organs and organ systems have time to develop and mature prior to delivery. So these three distinguishable germ layers are going to be virtually every tissue and organ of the body. Initially, they're identified as ectoderm. That's the integumentary system, skin, nerves. The endoderm, this forms organs of the digestive tract, glandular tissue, like the liver, the pancreas. And the mesoderm, that's going to develop into muscle, bone, and blood. So let's take a look at what's occurring during this process of gastrulation.
In this video then we'll look at the beginning of development, looking into the ovary at an unfertilized egg. It then gets fertilized by sperm which travel down the fallopian tube. So here millions of sperm coming along. Several of them will hit the egg and try to penetrate it, but one will win, as it were, go into the nucleus, and then there's a reprogramming process where the male and female nuclei have their genes set aside to be turned on and off for early development. Here you see early cleavage stages occurring, and this is one of the early growth phases. As the embryo moves down the fallopian tube, it's going to form an important stage called the blastocyst here in a few seconds. Of course, in real life that takes days, about 5 days. At this stage then, I'd like to draw your attention to the inside of the blastocyst, where there are cells called the inner cell mass, which I'll be abbreviating as ICM. Those are the cells that make the entire animal, and the outer cells give rise to the placenta and other supporting tissues. At this stage, the embryo implants into the wall of the uterus. This is when a pregnancy is really initiated. And now we'll see those blue inner cell mass cells form a disc, and then as the cells continue to grow, they change their physical positions, their kind of geographical relationship to one another. And you'll see that represented here as this disc gets transformed into an embryo. Those lines represent sites where cells are migrating in and out. And here's an important stage when the three beginning layers of the embryo, the so-called germ layers, are formed, and I'll come back to that in a few minutes. As development proceeds, there's more growth and movement of cells. It'll begin to form a neural tube. Here it turns, and appendages start to bud out. You see the head forming and the eye. And then eventually we get a small embryo, and some months later, of course, this would be born as a young baby.
Okay, so now that we've gone through the process of gastrulation that begins after about 2 weeks from conception, then we have during week 8 development, there's an embryonic heartbeat. At this point, the embryo is about a ½ inch to an inch long. There's a spinal canal, rudimentary arms, eyes, toes, fingers. And then after about week 12, the fetus is about 3 inches long. There is a rudimentary liver, kidneys, intestines, lungs. By about week 16, and by the way, at week 8, week 9, week 10, couples can go into the doctors and they can do an ultrasound and they can identify the position of where the embryo at that point has implanted, and they can take a look at the heartbeat. There is a Doppler that could ultimately generate sounds of the heartbeat. It could be observed through ultrasound techniques. By week 16, the genitalia is evident at this point. Bones are distinct. Through an ultrasound, little tiny vertebrae can be identified. The fetus has fingernails, eyebrows, a fine hair over the skin. And this again is at about the 4th month, week 16. By week 20, the fetus is about 1 pound. The fetus can open their eyes. There is a vernix caseosa, which is a waxy coating over the fetus. And that waxy coating is going to be important for protection. and that's also going to provide a slippery medium to help the fetus pass through the birth canal during childbirth. The vernix caseosa is produced by the sebaceous glands, and it can appear kind of pasty on the skin by about week 28. By this point, the fetus has pretty much developed the majority of their organs, and they're going to continue to grow and develop. This is a period of substantial weight gain. A lot of fat uptake needed for neurons at this point. And the baby's going to gain weight, and the brain is especially going to develop. So a lot of fat deposits in the brain and neurological development. Electrical connections are being formed. And this big-headed baby is going to develop into mom's womb. And over time, this is going to pose a challenge during the process of childbirth. However, the advantage is that big head ultimately results in a large cranial capacity for the size of the offspring. So in humans, this is correlated with higher intelligence. But a drawback is the delivery process is quite stressful on the mother. So here we see the development, starting with the release of an egg. And then here we have an embryo forming. Gastrulation begins. We start to see the embryo taking shape, taking form, distinct tissues. And then here we have the fetal development. And then the majority of weight gain and increase in size. Now, when a woman is pregnant and she goes into the doctor's office, she's given a gestational age. And this is identified by 9 months plus 1 week after a woman's last menstrual cycle. Now, that may not make much sense because if a woman is given a gestational age of 9 months plus 1 week after her last menstrual cycle, well, possibly fertilization hasn't even occurred by then. Well, the reason why this is administered by a healthcare professional is because this is a pretty accurate way of determining when the due date of the baby is. So the gestational age doesn't necessarily correlate to the exact age of the embryo. And here when you take a look at the gestational age, you see that, well, 2 weeks into development, the mom has just released her egg. So this is really given as a more accurate way to understand development and the due date of the offspring, not necessarily exactly what's happening to the embryo at the time. It's more giving a range of when to expect delivery for the mother. Now, during development, what this shows is initially during fertilization and cleavage. Remember, about 2 weeks after that embryo has formed, it's going to begin to take shape and go through the process of gastrulation. So during these embryonic periods, weeks 3 through 8, during this period, take a look at these dark colors. This dark area for heart development, central nervous system, eyes, ears, lips, midface, palate, teeth, upper limbs, lower limbs, even genitalia. You take a look at this darker color, this is representing critical or sensitive times during development. The period of development that is most sensitive is after gastrulation within the first several weeks. After that, those major organs and organ systems are pretty much in place, but they're beginning to mature. These are less sensitive areas, but certainly the offspring can still be affected. So some of those exogenous chemicals are especially problematic early during development because that's when the genes of the offspring begin the process of expression. These are called teratogens. Teratogens are agents that can cause congenital abnormalities. They could include marijuana, tobacco, alcohol. Now, what can be done for the mother to detect birth defects? Well, a blood test can be done, and a blood test can be done more than one time throughout a woman's pregnancy. These start in the first trimester, and this can be done to establish the mother's blood type. This can also be used to monitor hormones and proteins. Because sometimes during development, if the offspring is abnormal or has a developmental disorder, sometimes hormones and proteins could be accelerated. And that could give the doctor an idea that, you know what, we may need to investigate this further. If there are certain hormones or proteins that are out of their normal distribution, a doctor may want to investigate this further to determine if the child has a condition like Down syndrome. There's even a cell-free fetal DNA analysis, where the blood of the mother could be taken and analyzed to see if there's any fetal DNA inside the mom's bloodstream. This is a less invasive technique to look for any type of developmental disorders. There's also an ultrasound. An ultrasound is done typically about the 10th to 14th week, and it's used to detect and locate the developing fetus and to look at dimensions. So an ultrasound technician will usually measure or take pictures of the spacing between the eyes, the length of the digits, any type of fatty tissue that may be deposited in the back of the neck. And what the ultrasound technician is going to do is take these photos and then send them off to a doctor. A doctor would analyze them, and these would be good markers to indicate, is the location of where the offspring developing, is it in a good location of the uterus? Are there any visual cues that may indicate possible developmental disorders? Again, like Down syndrome. Chorionic villi sampling. This can be done by about the 10th or 12th week. This is where protrusions on the membrane surrounding the placenta, they're removed. And this could be done in order to analyze some of the content from the placenta. Remember, the placenta was developed really from the embryo interacting with the blood vessels of the endometrium. So if some of those extensions or cells from the placenta are analyzed, that could be used as an indicator of developmental disorders. Amniocentesis can be done at about the 15th through 18th week. This is where a needle could be taken, and that could enter into a woman's amniotic sac, and a doctor would use an ultrasound device to ensure that the needle did not poke the baby. And during this process, while amniotic fluid is taken out, because some of those fetal cells can shed inside the amniotic fluid, those fetal cells can be cultured and they can be analyzed. This can give a wider diagnosis of the development of the offspring, just to ensure that the offspring is developing in a normal fashion. And because this chromosomal analysis can be conducted, this could give the doctor an idea if the baby has something like Down syndrome, or even spina bifida, which is an incomplete closure of the spinal cord. So here we have amniocentesis, conducted at about the 15th to 18th week. And this process, pretty invasive process. The doctor would use an ultrasound to ensure, as that needle goes into the mom, that it only draws out a little bit of the fluid. With chorionic villi sampling, this catheter would enter into the vagina and take a little piece of the placenta out. That could then be used for an analysis for any type of developmental disorders. Typically, amniocentesis and chorionic villi sampling, these are conducted when a woman is considered high risk. If the doctor, in other words, the doctor wouldn't want to perform an amniocentesis or chorionic villi sampling unless there was a reason to do so. The older age of a mother, well, there could be a higher risk associated with that. Maybe during the initial blood tests, maybe if a woman's hormone levels were out of whack, or if there was an increase in certain markers, that could give the doctor an indication that he may want to investigate this. So again, with these invasive procedures like amniocentesis and chorionic villi sampling, they are only conducted unless a woman is considered high risk or the doctor has an indication that the offspring has a developmental disorder. Well, another condition is an ectopic pregnancy. This is where the developing offspring can grow inside the fallopian tubes or even the ovaries or cervix. During this process, this can be problematic. This can be problematic because the fallopian tubes, they don't have the ability to expand like the uterus does. So if a doctor had identified that implantation had occurred within the fallopian tubes, they would absolutely have to remove this. If they did not, the embryo can grow and grow and eventually rupture the fallopian tubes, causing hemorrhaging and internal bleeding. So symptoms include abdominal pain and bleeding. Another condition is called blood group incompatibility due to the Rh factor. The Rh factor is a surface protein on red blood cells, and not everybody has this Rh factor. If you've ever heard of an individual describing their blood type and they say something like they're O positive, that positive indicates the Rh factor is present. Well, if a father is Rh positive and the mother is Rh negative, there's a chance that the offspring can be Rh positive while the mother is Rh negative. The reason why this can be problematic is because this surface protein on the red blood cells of the fetus, well, they could be different than the surface proteins on the red blood cells of the mother. The mother's immune system can identify that difference in surface proteins called the Rh factor. And the mother's white blood cells can attack the red blood cells of the baby, of the offspring. So the mother's immune system can make antibodies to attack the Rh antigen on fetal red blood cells. Well, you might ask, why would that be a problem? Doesn't the placenta really filter the maternal blood from the fetal blood? Yes, it does. However, during the first delivery, that's typically not a problem. But during subsequent pregnancies, the mother could have been exposed to fetal red blood cells after the first delivery. And that's why during subsequent pregnancies, the mother may already have antibodies that can indeed cross the placenta. So this is usually problematic, not on the first pregnancy, but on subsequent pregnancies. So fortunately, doctors could administer a shot called RhoGAM. And this is administered to act as an anti-Rh antibody. Essentially, this hides fetal red blood cells so the mother's immune system doesn't make antibodies to target and attack it. Because if the mother did produce antibodies against fetal red blood cells, the baby could be born with hemolytic anemia, may need a blood transfusion, may miscarry. Now, what about the process of twin development? Well, there are two different types of twins. There are fraternal twins, and with fraternal twins, if a mother releases two eggs simultaneously, each of those eggs could be fertilized by different sperm. Each of these eggs that are now fertilized, they can implant into the uterus, and that's why with fraternal twins, you could even have different sexes. The DNA would not be the same because different eggs were fertilized by different sperm. So this occurs when a woman releases two eggs during ovulation. With identical twins, what occurs is you have one egg that's fertilized. This fertilized egg begins the process of cell division. And during this process of cell division, this embryo splits. When it splits, each of these begins to divide independently. However, as they begin to divide independently, remember, they both started from just one fertilized egg. So that means they have the same starting materials and the exact same DNA. With identical twins, this is when a zygote or early embryo splits. So these identical twins would have the same DNA, they would be the same biological sex, and they would appear to look exactly the same. So now that we've talked about the process of pregnancy, we've taken a look at ways that we can check for the health of the baby. Now let's take a look at some of the changes that a mother experiences during an established pregnancy. Now during the first trimester, women go through a number of different physiological changes. Increased urination because of hormonal changes, enlarged breasts as some of the milk glands begin their process of developing, darkened nipples, pigments around the nipples cause them to darken, fatigue, nausea, vomiting, and that's because HCG is highest in the first trimester. For many women, the first trimester of pregnancy is the worst due to the nausea and the vomiting. Many women get food aversions, and they like to eat very bland foods. Now, during the second trimester, many women attest that this would be the most comfortable trimester of their pregnancy. Women often experience thickening of the waist as the uterus begins to grow. The fetus is releasing hormones, and some of those are going to cause the uterus to relax and expand. Women will experience increased salivation, perspiration. Oftentimes, women take supplements like iron because their red blood cell count increases to deliver some of that blood to the offspring during development. Women may experience heartburn, indigestion, constipation, hemorrhoids, varicose veins. But morning sickness tends to dissipate because HCG levels drop. During the second trimester, especially later in the second trimester, from about the 6th to 7th month, quickening, where fetal movements can be felt. And these can become a lot more pronounced and evident in the third trimester. During the third trimester, this is where the uterus begins to tighten its muscles. Braxton Hicks contractions occur especially late in the third trimester. Where pregnant women, they may experience involuntary contractions of the uterus. This could be uncomfortable. Shortening of breath, heartburn, indigestion. As that uterus increases in size, that pushes on organs, putting stress on the pregnant mother. That stress could make it uncomfortable to walk, even sleep. Many women sleep with a large body pillow, and it's difficult to get comfortable. Now, during an established pregnancy, there's a misconception on how many additional calories women should consume. Normally, women consume about 1,500 to 2,500 calories per day. And it's not as if women should double that number during an established pregnancy. The mother needs an additional 250 to 300 calories per day upon an established pregnancy. So it's important to emphasize it is not a good idea to consume excessive amounts of food during pregnancy. If a woman gains too much weight, that could be difficult for a woman to deliver. If a woman maintains an unhealthy weight during pregnancy, she may even develop gestational diabetes. So this shows the distribution of weight gain. About 6 pounds of muscle and fat, about 7 pounds of blood and extra fluid. Breast size increases, uterus increases, placenta is about 1.5 pounds. The average fetus is about 7 to 8 pounds, right around 7.5 pounds. Amniotic fluid about 2 pounds. So on average, women should gain about 28 to 30 pounds during a healthy pregnancy. Now, there are some misconceptions about activities that women can engage in during pregnancy. Mild exercise is considered to be okay. Even sexual activity is considered to be normal and healthy during a pregnancy. So here we have the vernix caseosa as this fetus is increasing in size and the mother is experiencing the uterus expanding. We have this vernix caseosa, and this vernix caseosa is produced by the sebaceous glands at about the 20th week of development. So prior to delivery, the baby's head is going to drop and descend into the pelvis. The pelvis will actually widen a little bit. Now this is called engagement. And this occurs about 2 weeks prior to delivery. And women, they hold their baby lower on the abdomen during this process because the baby begins to descend. So now that we've talked about what to experience during a pregnancy, let's talk about the process of childbirth. And before we get there, it's important to note there is a number of resources that women often go to see the types of changes that she may experience herself, and also the types of changes that are occurring of her offspring during a pregnancy. There are books like What to Expect While You're Expecting, and nowadays women can even download apps where daily or even weekly a woman can check her phone to see the types of changes that her and her offspring are experiencing during a pregnancy. So now let's discuss the process of childbirth. Because the process of childbirth or labor occur in 3 phases. So this baby is large, going to put stress, and that is going to initiate labor. So during stage 1 of childbirth, well, stage 1 of childbirth is initiated by progressive and regular contractions. And these progressive and regular contractions, these could occur in intervals about every 20 minutes or so, but they do not slow down and they do not stop. And the time in between these contractions, they begin to increase and get stronger. That is when a woman begins labor in stage 1. And during these progressive and regular contractions, the cervix is going to thin. That's called effacement. And then that cervix is going to begin to open up. That is transition. And that cervix, as it opens up, it's going to open up to about 10 centimeters. And this is incredibly important because during this process, labor and delivery nurses, doctors, they're not going to have a woman contribute to these contractions and push until the cervix is completely dilated to 10 centimeters. There's no point. If the cervix hasn't completely dilated, then a woman, well, she's going to be pushing and the baby won't get through the opening. So she's going to exhaust herself. So this process of transition is incredibly important. And this can take anywhere from 4 hours and very quick initial stages to well over 24 hours. The amniotic sac ruptures, and if it hasn't ruptured, a doctor can go in and rupture that. The mucus plug is expelled, and that mucus plug helps keep any bacteria or viruses from entering into the uterus during development. As a woman is experiencing regular and progressive contractions, and the doctor identifies that the woman is progressing okay during stage 1 of labor, many women are given an epidural anesthesia. And during this epidural, a needle is going to guide a catheter right into some tissue outside of the spinal cord. This anesthetic is going to diffuse, and when it diffuses into these nerves that innervate the genital area and even the legs, women will experience some relief during this process because this begins to get extremely painful. So here we have the cervix thinning. The baby's head is pushing on the cervix and it's beginning to thin. And also as the uterus is pushing on the offspring and the cervix is beginning to thin, we also see that this opening is beginning to increase in size. At about 10 centimeters, now transition has occurred and a woman can enter into stage 2. So a nurse may go in about every 30 minutes to an hour and just feel the opening to ensure that the opening is large enough for that baby's head to get through. Then typically the nurse would call the doctor in and say transition has occurred. It's time for the woman to begin the process of pushing the baby out of the birth canal. So stage 2 of childbirth occurs when a baby moves into the birth canal. During this time, women contribute to contractions. And contractions by this point could be every couple of minutes, maybe every 3 minutes, every 3 to 5 minutes. The baby passes through the cervix, the vagina, and this ends when the baby is born. Now this process is typically much faster than stage 1. This could be anywhere from 30 minutes to an hour and a half or 2 hours. This perhaps is the most painful portion of childbirth. Now, the offspring could take on numerous positions during birth. If the offspring was in a position like here in A, this would be referred to as a breached birth. And this would be very dangerous, because if the offspring was delivered feet first, they could suffocate as they're passing through the vagina. If they suffocate, lack of oxygen can cause certain brain cells to die, and that can result in complications during delivery. Here we have an offspring that may get stuck in the pelvis. So the uterus can push and push and push, but if the offspring can't get through the pelvis and can't move into the correct orientation, then the doctor may say, you know what, let's wait an hour. And then after the doctor maybe waits to see if the baby takes on the correct orientation or position, then the doctor may say, let's go in and do a cesarean section. The optimal position would be the baby face down, so the baby can pass through the pelvic bones, through the cervix, and out the vagina. Complications result in cesarean section. A cesarean section is when a doctor is going to make an incision in the pelvic area to take the baby out through that process. Rather than going through the vagina, they would make an incision on the lower portion of the abdomen, and that can be done during complications. Maybe the baby isn't taking on the proper position. This can also be done if the baby if the baby is not in a proper position. If the baby's heart rate increases too fast, the doctor may say, you know what, let's go in and let's do a cesarean section immediately because that baby's under a tremendous amount of stress. If the mother is infected with an STD, that can be problematic because the baby can be exposed to that STD during the process of childbirth. That's another reason why a cesarean section may occur. So here we have crowning. In stage 2, as the woman pushes, you see that as the baby's head passes through, because of the elasticity of the vagina, the baby's head passes through, and now the baby's head is passed through the birth canal, and the doctor can pull the baby out. A doctor may elect to perform an episiotomy. This is going to help regulate some of the tearing that a woman may experience during the process of childbirth. Last, after the baby's delivered, the doctor would clamp the umbilical cord, cut the umbilical cord. They'll often ask the significant other if they want to cut the umbilical cord. And then the umbilical cord would still be inside of the woman's vagina at that time. That's because, remember, the umbilical cord is connected from the baby to the uterus. So from the baby to the placenta. So approximately 30 minutes after delivery, the placenta detaches from the endometrium. And this can occur within 10 minutes after delivery. But the doctor would ask the mother to give one more contraction, and then that placenta would be expelled. Sometimes even cells from the placenta or the umbilical cord, they could be stored with umbilical cord banking. That could be useful if there's a history of diseases in the family, and those can be frozen and they can be stored for later use if that offspring needs them for any types of diseases. Now, after childbirth, when a woman breastfeeds, initially the first day or two, she produces colostrum. This is actually not very rich in fat. It's very rich in protein and antibodies. The baby was developing within a nice microbial-free environment, and now they're exposed into a world full of bacteria and viruses. So this colostrum could aid in immunity. Milk production occurs shortly after. The milk can also have antibodies that aid in immunity, but the milk is going to have a lot of fat, and that's important for neurological development. Sexual intercourse. Wait, Wait for the woman to heal. Women could experience tearing. Often there are sutures that are going to help the recovery process, and this may take weeks. 4 weeks, maybe several weeks. This area could be very sore. And after the process of childbirth, women could experience a continual amount of discharge. That's called lochia. There can be blood, there can be discharge, and sometimes women are given padding that they're using inside of their underwear to catch any type of fluid or blood that's discharged, because this discharge could result for weeks after delivery. Also, it's important to note, during the process of a pregnancy, the offspring is producing, specifically the placenta, is producing a whole lot of hormones. So these hormones are important because they're establishing communication between the offspring and the mother. But after the process of delivery, a woman has just gone through one of the most strenuous and stressful periods of her entire life. If she has gone through this process that's incredibly stressful, and then she's recovering from this and has to wake up every couple of hours to feed the baby, this can be incredibly difficult. Women often experience emotional highs and lows, and this can result in depression. This is very, very common. And it's important for women, if they experience postpartum depression, to seek support groups. Often healthcare facilities have support groups of new moms or existing moms that can come in, and they could speak with others, and they could have an idea of what constitutes as normal and know that they're not alone. In extreme case of postpartum depression, there was a woman in 2001 named Andrea Yates. Andrea Yates had 5 children. She drowned all of them. She killed all of her children in 2001 in Texas. And she claimed that this was really the result of a postpartum psychosis that developed from postpartum depression. Fortunately, not all cases are that severe, but that is just an example to show how this can escalate. Okay, that'll be it for Chapter 8.